Our presentation today, titled COVID-19, the transformation of public spaces due to the pandemic, addresses urban interventions that took place in the cities of Toronto, in Canada, Recife, in Brazil, and New York City, observed in each city between May 2020 and July 2021. This presentation is structured in three parts: an introduction, a discussion of the intervention that took place in each of these three cities during the pandemic, and final thoughts. It was prepared by Maria de Luz Nobrega, Isabella Trindade, and Ana Luisa Rowling. The coronavirus disease, COVID-19, began to spread in mid-December 2019 from Wuhan, China, first to the cities within the country itself, then from January 2020 to more than 200 other countries being declared a worldwide pandemic. Due to the pandemic, safety protocols were adopted to contain the spread of the virus, with changes in habits such as wearing masks, washing hands, frequent use of hand sanitizer, cleaning and disinfecting surfaces, and keeping social distance from others outside of our home. Part of the population is started to work remotely from anywhere. Events which large gatherings were cancelled, businesses and services considered non-essential were temporarily closed, and educational institutions started to teach remotely as well. At the same time, cities have implemented safety regulations and protocols for use of public spaces. So, at the beginning of the pandemic, we started to see a shift in how people used public space. Among many changes in a short period, cities empty due to the measures adopted to contain the virus. And then we saw some cities present urban actions in response to the restrictions imposed based on the principle of urban sustainability. Compactness, which goes against urban sprawl; completeness, which proposes a mix of uses; and connectivity, which allows access to the uses proposed by completeness by foot and or through the use of collective transport. And finally, permeating all these principles, that is walkability. It is through the pandemic that a paradox arises regarding the use of urban public space. On the one hand, the practice of sustainable urbanism requires basic urban actions that favor greater density, rapid connectivity between places, walkability, and the use of public transport. On the other hand, the contingencies for the use of these spaces and collective forms of locomotion so as not to spread the virus came to define them as areas susceptible to crowding of people and consequent risks to public health. At the first moment of the pandemic, the general practice was for public authorities to adopt social distancing measures, lockdown, stay-at-home order to prevent the spread of the virus, and only authorize the operations of essential services. The use of open space was then understood as a good practice of urban sustainability in response to the urban paradox created by the pandemic. To this end, cities started to host actions of tactical urbanism, also known as guerrilla urbanism or emergency urbanism, promoting principles of sustainability in urban spaces, minimizing economic and social losses during the pandemic. Tactical urbanism consists of simple, quick, and low-cost actions, such as painting the street, adding street furniture, creating parklets, etc. and also temporary changes to the built environment. Starting from this initial context, which requires safety protocols, recommendations, and hygiene measures, in addition to normative adjustments for the use of public space, the goal of this article is to present urban intervention that took place in the three cities involving the use of public space during the pandemic. In Toronto, the lockdown and stay-at-home order was imposed together with a set of initiatives that were created in response to the pandemic: ActiveTO, CafeTO, and CurbTO programs. ActiveTO is about making sure people have space to get around while respecting physical distancing. Initiatives include closing major roads for active transportation, expanding the cycling network, and implementing quiet streets. Quiet streets designated 65 kilometers of streets in 31 locations are shared space to enable people to maintain physical distancing while walking, running, using mobility devices, and biking. On these streets, signs and temporary barricades open space on the street by encouraging slow local vehicle access only. New bike lanes were installed through temporary materials, and this is the largest one-year expansion of one street bike lanes ever in Toronto. Approximately 40 kilometers of on-street cycling lanes approved for accelerated installation in 2020. With private gym and playgrounds temporarily closed, public outdoor spaces such as parks, beaches, squares have become vital to people's physical and mental health. There was a significant increase in the use of these outdoor spaces despite the imposed lockdown. So, signs on the floor of sidewalks with greater circulation were added to indicate social distancing, and in parks, white physical distancing circles were painted on the grass, inviting people to enjoy the outdoors while staying at a safe distance from each other. Toronto restaurants have been closed for over 1 year since the start of the pandemic, working only with delivery and or people picking up merchandise purchased by telephone or internet. The goal of the CafeTO program is to provide space for expanded dining areas to help restaurants and bars who are impacted by COVID-19 while maintaining physical distancing requirements, creating revenue generation, and bringing vibrance back to our main streets. This included 6 types of cafes: sidewalk cafes located on the sidewalk adjacent to the front, curb lane cafes located in the curb lane of the road in front of the restaurant, small frontage cafes located directly against the building, flankers cafe located on the sidewalk or boulevard along the side of a restaurant, parking slot areas converted into public space with tables, chairs, and food trucks, and patios on private properties. In addition to CafeTO, curb lane pedestrian zones were designed to provide additional space for customer lineups, and over 130 temporary parking pickup zones in location across Toronto. Brazil counts more than 600,000 deaths and 22 million people diagnosed with COVID-19. The responses from the federal government, which should have taken on a coordination role considering the National Health Service, were confusing and inefficient. Doubts and skepticism spread by the president, undermining the work of governors and mayors, and contributed to increasing the number of cases and casualties. The Brazilian president has called the COVID-19 disease a flu, disregarded social distance measures, and raised doubts against and criticized the use of vaccines. Governors and mayors had to produce their own regulations to fight the virus. Recife, located in the northeast region, is the fourth largest urban area in Brazil and, like other Brazilian cities, suffered from a lack of public policies and informational guidelines at the national level. At the beginning of the pandemic, parks, beaches, boardwalks, and bike lanes were closed. Both the state and municipal government regulated the functioning of services and activities depending on the different stages of the pandemic and the number of deaths caused by the new coronavirus. So, different degrees of greater or lesser flexibility for opening up commerce and services and for the use of urban public spaces were created depending on these numbers. However, actions involving the practice of emergency urbanism were not found. At the same time, already planned actions of tactical urbanism were implemented in the city, promoting the widening of sidewalks and pedestrian crossings through the painting of roads and in order to better ensure walking and calm traffic contributing to urban connectivity. New emergency cycling routes that specifically responded to the demand of the pandemic were not created in the city. They were implemented in response to the Recife Master Plan, which contributed to the increase of routes in the period analyzed. Square, beaches, and parks remained closed during the first stages of the pandemic and were reopened in June 2021. Signs were placed in this location to alert the population about the virus and prevention. Sidewalks, signs for social distancing were carried out by the municipal power, mainly in front of the banks, due to the large number of people lining up to get help from government programs that were offering temporary COVID-19 financial assistance. Recife has bars, restaurants, and street vendors that traditionally use sidewalks, used outdoor spaces to place tables and chairs for the consumers, but no tactical urbanism actions focused on COVID-19 were identified in this period. Bars and restaurants were closed at the beginning of the pandemic, and like parks and beaches, they were only partially open with 50% of the total capacity and social distance protocols depending on the different stages of the pandemic and number of deaths caused by the new coronavirus. In New York City, the municipality launched several alternatives to deal with restrictions on the use of public spaces, from the most basic focus on security protocols, as we see in these images, in subway stations and public parks, to more specific programs that we will share on the next slides. The programs created by the municipality that we are discussing are the Open Restaurant, the Open Street, Open Boulevard, and Open Culture. The goal of these programs is to encourage people to interact outdoors without compromising social distancing, hygiene, and mental health recommended in this context. The Open Restaurant program expanded outdoor seating options, granted permission to install tables immediately in front of the building, using the sidewalk or the road adjacent to the building. Its main goal were to promote the use of open space, ensure social distance, and help establishments to recover financially. The image above shows a diagram that illustrates the design recommendations. A great aspect of these programs is this accessible nature becoming a manual for intervention in public space. The initiative demonstrates that it's possible to reduce bureaucracy in urban regulation, make them agile and with the potential for adaptability. This refers to temporary interventions, the basis of tactical urbanism, which respond to changes in the nature of public space, making cities more participatory and livable. The open streets focused on closing streets to cars, making them safer for pedestrians and cyclists. The initiative made it possible to close roads from 8 a.m. to 8 p.m., leading to 139 kilometers of open streets by the end of 2020. The Open Boulevard program was launched to promote cultural activities, communities events, and art installations. On these roads, small businesses, restaurants, artists, pedestrians, and cyclists could meet, creating the kind of destination expected in a city like New York. Another recent program, effective since March 2021, is the Open Culture, a type of license that provides the use of roads for presentations. These encourage the recovery of the arts in the community, offering cultural experiences to the population controlled by ticket valid for 1 day. In this way, income generation opportunities are also created for these sectors. The impact of these programs is significant. It is clear that even in the face of the sick context generated by COVID 19, it was possible to emerge as a healthy city which embraces and uses its lifestyles, allowing people to circulate, having fun, and eat out. These programs and the streets generated an enthusiastic atmosphere full of life and excitement, just as one of its most distinguished residents, Jane Jacobs, dreamed of. A new form of emergency urbanism is revealing the promise of what could be, as improvised pilot projects are quickly implemented, testing what works and what is not. This is a powerful demonstration of city resilience, providing essential choices in a moment of crisis, but also pointing the way to adaptations that have the great potential of becoming permanent. In these three cases presented, we saw that planning, designing, and enabling the management and programming of public spaces, even in a moment of pandemic, directly contribute to the practice of sustainable urbanism, since, in this context, economic aspects and the physical and mental health of citizens are also considered. As life begins to return to normal or to a new normal, initiatives such as these constitute opportunities to assess the capacity for change and adaptation in the face of crisis and provide an opportunity to think about the city we want, about how to live and overcome the deficiencies present in the urban environment. Thank you very much.